and then we'll make a start. Right, okay, thanks. Put the chat on. Good morning, everybody. Welcome to our November stroke, nearly December education safeguarding network update. And we've got lots to get through. So got about two of our guests. We'll introduce them shortly as we go through. So let's move on. This is the last one before Christmas because we don't run one in December. We know how busy you're going to be. We do, appreciate that you're going to be really, really busy in December and January. That's our agenda for today. So Jeff's talking to us about prevent, and I've got a little bit to add on. Families first for children, schools transport, and lifelong learning are some of our main things. Quick mention of our who's who. And quick mention of our who's who. So Amy in the front door will be returning to the front door at Christmas from her role as the early help lead and the education lead there. And Dawn will be returning to her role as the education lead after Christmas, I believe, or maybe somewhere around that time. So on to the next slide. So we've got changes to our team. Heidi, very sadly for us, Heidi's moving to a new role. We'll miss her very much. She'll be moving into the front door, Children and Families front door, and we wish her well, congratulate her on that new promotional role. And we will be offering support with this transition. We'll have aimed to avoid any disruption to the changeover. Heidi will be remaining with us for the key training, so that will keep going. Don't panic, don't worry. There will still be training, and Heidi will be staying with us for that, and we'll still work together closely. So, but lots and lots of changes going on through Pathfinder, but we just want to say thank you to Heidi for all she's done. You will see her again, but can we just say a big thank you to Heidi, please? She's a virtual round of applause for all the work she puts into everything to do with safeguarding and training. She's done a fantastic job, and I'm sure you'll agree. She knows what she knows everything there is to know. So thank you. We wish her all the best. Okay. Moving on, like I say, some of the training will continue. There's still training to go before Christmas. We've got early help. We've got DSL updates. We've got Chris, who's joining us for the Brook training, joining Heidi for the Brook training. And if you remember, Chris used to be the one man that did all of the harmful sexual behaviours in Warwickshire on his own. And now we have fabulous Brook training. We have a team now. But Chris is our resident expert, talking about the traffic light tool to identify, understand and respond to harmful sexual behaviours. Please do have a think about your audit, and did you put down that you were going to try and do Brook training this year? Were you going to do domestic abuse training? Just have a little check and get yourself signed up. It's still going on. Okay, talking of domestic abuse training, one of the things that will be happening was Heidi will be passing over some of her training to what's called the Practice and Learning Hub. That's the team that do all of our training internally. And I'll come to you in a minute, Manjit, if you've got a question. We'll do Practice and Learning Hub. We're going to be providing our training for schools and everyone, so don't worry. Training will still exist. You can access the training we can access by going onto these pages. There's a link there for you. And one that you can try out is domestic abuse training, which is offered. A lot of the stuff will also be linked to the Warwickshire Children's Partnership now, and that's really in most cases who do provide the training for safeguarding anyway. So you can access that link and you can book on through those links there. So that's one you can try out to try the new system through the partnership and through the Practice and Learning Hub. Okay. So carrying on, lots of stuff to talk about over Christmas. We want to encourage you to think about families at Christmas. Obviously, I know you do. I don't need to remind you, but there's lots of stuff on the FIS newsletter. There's stuff about the half at Christmas. There is a half offer. It's really hard to say all of this. Make sure my teeth are in. Just be aware of that, and there's no funding yet for after Christmas, but we're hoping that will happen. So there's half code for a maximum of 4 funded sessions goes out this week, so it should have gone out already. So look in your emails, and there's a referral link for young people who are not eligible for benefits, and you can find out how to meet the criteria for half half funding or half accessing the activities through the link on there, and wraparound childcare. If you're expanding that, the offer to expand that is there. If you want help with that, please contact FIS and they can advise you on that if you're an early years provider and you're expanding your offer. So please try and encourage parents, put that in your newsletters, encourage them to access these things at Christmas. We know, poverty is going to be possible, winter fuel, all of those things. So there's lots of things on there. There's a video on there about money issues, and some of these things you could put on your website or share. Relational support. We know that, there can be really difficult times at Christmas for families. So, put that stuff in their domain so they can have access to it if they need it. Not everybody enjoys Christmas, and sometimes there's really unpleasant things that happen in families. So there's some stuff there, stuff on mental health on Kooth as well. Okay, can just mention Lifelong Links briefly, and then I'll come to one of our guests. This is something you may have heard about in Head's briefing, and Laura and Jessica will be coming after Christmas to talk about this. So this is about young people who have been in care, and we want to try and give them some support along the rest of their journey through adult life or as children. And so it's engaging with family members or people, even teachers that they used to know. So they've got somebody in their life that is a bit of a rock, a bit of a safe place. And it links to Family Group Conferencing, which we're changing its name. So you may have seen this as a video, but we're not going to show it today. You can watch that when you get the slides. And the positive experiences of some of these young people who've had really tough lives, when they've had contact with somebody in their life, they have all of these things to say. Just having somebody, particularly something like Christmas, if you think of young people that maybe haven't got families or separated from their families, think about their experience of Christmas and having just somebody there. What they are talking of doing is asking potentially teachers to be included among their contacts, and we do know all about the risks of that, and we are talking to them about how to safeguard, how to mitigate, how to keep in touch with some of these young people. So we're not going to just say do this and then let you fall foul of child protection procedures or codes of conduct. So we will talk to you about that after Christmas, all right? But I just want to sow those seeds and think about these young people that have maybe been in care and are on their own at Christmas. So have a think, get involved, investigate, see if you're happy, and then we'll tell you some more. I'm going to introduce Ben now, who's with us, Ben Sheath from Transport. He's a safeguarding training lead, but I'm sure he's going to tell you that himself. Over to you, Ben. Welcome.
Hiya, thank you, Carl. So my name's Ben Seath, and I taught Year 6 for a number of years in Coventry. I'm the new Transport Safeguarding Training Lead, and I'm also one of a handful of DSLs within Warwickshire County Council Transport. So I'm here mainly just with a few different reminders on information that might be something you've heard before, or it might be if you're a new leader, a new DSL, this might be new to you. Just about what we do, how to get in contact, and how we might be able to support. So you might be aware that some of your children might qualify for free home to school transport, and it's my sort of department that will sort that out. We'll get in contact with local taxis, and we'll kind of sort out the routes and kind of do the logistics side of that. So we know there are often issues with home to school transport, so we welcome any feedback on how we can improve. You might have seen some of our staff inspecting vehicles outside your school in high-vis vests, and some of you might already have a contact with us that you regularly communicate with. I'm not replacing them, I'm just another person in the team. So just some information that might be useful for you to know. If there's a pupil on our service who has an EHCP, then what we do is we take that, we remove anything that's school specific, and we pass that on to the drivers. We call it a risk assessment. So every driver should know that child's triggers, their needs, their diagnoses, and that's run by the parents as well. So everyone involved with that child should hopefully have that information. In my role, and I'm on a session today, that's why I'm in a very echoey room. I provide safeguarding training for the drivers and the passenger assistants. They're sometimes called escorts, but they also receive health and safety training. We call that PATS and first aid, and they can't work on transport without a valid DBS. So we've got those different safeguards in place. So I'm one of a handful of DSLs that will help with any sort of transport related safeguarding concerns. And we have some preferred ways that you would get into contact with us. So on the screen, you can see the QR code. So in addition to your usual safeguarding procedure, whether that's green and yellow forms or CPOMs, if you could, if it's to do with transport, use that QR code on the screen. You can put any safeguarding concern through there just to let us know. Obviously, you still can get in contact with Ladder and Front Door. We don't replace anyone. It just gives us the context. And it means that we can provide support and communication with the operator. And we can also make sure that if there are any staff that are unsuitable, that they're moved on to the to somewhere else, or we can change routes around if we need to. Oh, there seems to be. Oh yeah, there was some missing. There you go. Thank you. So if you can just go back, Carl. Sorry. Just back to the other slide. So if there's not an immediate risk for the child, so if they arrive late, for example, in a bad mood because of a bad journey, or if there's a concern around the driver, please use that QR code. It's similar to your green and yellow form. It's that sort of same level, and it just lets us keep track of what's happening on transport. Myself and a handful of other DSLs check that daily, and we will action every concern, but it might not be straight away. But it's usually the same day. We're also really happy to share updates with school and with home, but we do ask that parents and carers are informed, at least initially, by the school on that same day, because you've got that pre-existing relationship with the family. And then the orange bit there on the screen, if there is a more urgent concern and you think something needs to happen that day, get in contact with us. Our number's on the screen, and use option 1 to speak to transport operations. What they can do is they can change the company, they can change the driver, and they can make sure that if that child's had a really rough experience that morning, they don't have the same adult then that afternoon. Okay, now the next slide, please, Carl.
Thought I'd put a bit of animation in there to
I think that's because I've taken this slide from the training I'm doing today. So this is what they're told, and it's just to kind of reinforce the fact that we're the same level as the sort of your green and yellow form. It's more of an information, then we'll act on that. Next slide, please.
And just to say, we have issues that do happen, don't we? And I know how fast you guys really respond. You try really hard to respond.
We do try our best, yeah.
Sometimes people contact me and I put them in touch with you guys. Back to you, Ben.
Yeah.
Thank you.
Great, thank you. So my contact details are on screen, and I'd love to hear from you if you've got any questions or any suggestions of things that you think we should be aware of. That'd be great. And I've also included my manager, Sam Powers, on there because it's likely you'll hear from him if you do put a safeguarding concern in at some point. So that's us. That's our email addresses. If you want to get in touch, please do. That's a bit of a whistle-stop tour. I'm hoping I'll be able to speak to you again at some point about this. But yeah, thank you very much, Carl. Thank you for the time.
It's brilliant. Thank you. As somebody in the comments have said as well, they've been brilliant. You've been brilliant. Thank you very much. A couple of people said quick responses. So I think it's really good to have a face to picture and to know there's somebody there that's caring at the end of the phone. So really appreciate it. And people have got your contact details. So thanks for joining us.
Thank you.
Thanks. We'll invite you back again. Okay, I was going to do a quick mention of our area networks, our area clusters. We've got our different people in your areas, and you may or may not be aware of this. These are our people that we've got in your areas. I'd hope to put some feedback on today, but it's been very, very busy. So these are our contacts in our localities who set up your network cluster groups. And just to say thank you to all these guys that have been doing that so far. I know a number of you have had meetings, and it's just at local level to get you guys together, DSLs from each school. Sometimes people feel quite isolated, and if you can just get together in your local groups and talk about safeguarding, some of the visitors, some of these speakers come and join you, and you can meet them face to face. At the police and social workers and early help and lots of other people attend. So we're going to try and gather the information, and I'll get all the dates. I've asked the leaders for all the dates for next term, and we'll be sharing that with you when we've got all that information, so you can find out when your next meeting is. If you're not on a network and you haven't heard anything about that, let us know and we'll link you up with a local network. Just to say, Sam Godfrey will be changing from being the lead for the Ulster group, but we're maybe looking for another lead for that if we haven't already identified somebody. If you're interested, please let us know or contact Sam Godfrey. Okay, so thank you guys who are leading those, and more to follow after Christmas. And Angela says our cluster is vital to us, so thank you very much, Angela. And bear with us. Some of these people are doing this, they're all doing it voluntarily, first of all, in their own time. They really want to make a difference locally to the contextual safeguarding, to change your localities, very aware of different areas and what their challenges are. So thank you all these guys that do this voluntarily. A quick mention then, if you've seen this maybe on Heads Up or in the Heads briefing, this is about volunteers, and it kind of links in with Jeff's going to be on in a minute talking about the negative side of challenges of Prevent. But this is a positive thing about working with some of our migrants in schools who really want, they're professionals in their own countries, their original countries where they've travelled from. They could be teachers, doctors, lawyers, and then they've come to Britain and they've got families in school potentially, and they want to use their time effectively. They're looking to volunteer in schools, and they've got skills. So Karen Payne is the coordinator and can help you get some of these people opportunities in schools. We're working with them on safeguarding. We're using our September safeguarding training. You know, when you get your September safeguarding narrated by the lovely Heidi, we're going to use that as the training package alongside any of your own safeguarding induction training in school. So they've got the opportunity to work in your school to help you, to work with MTAS, to, you know, potentially work with some of your young people that are migrants and need that extra help with EAL. So please do have a look at that and find out more. And there's more to follow probably after Christmas on that one. Prevents and updates and reminders from Jeff now. Welcome, Jeff. Nice to see you.
Hi, good morning. Thanks everyone for the opportunity to just cover a few things. Carl, if you just put through the next slide. So my contact details.
I'm sorry, I'll go back. There we go.
Yeah. So I'm going to just briefly touch on aspects of risk assessment, some of the documentation and support material, some of the training opportunities that have been established for schools. The next slide, please. Thanks, Carl. So this is a very different offer because it's coming directly from West Midlands Counter-Terrorism, and I just want to kind of alert colleagues to the product and how to book onto it if you're interested. So it will be held at Warwick, so on 29th of January. They've called it Synergy, and essentially it is a interactive learning pack. So it is a kind of resource that you can integrate within your lesson plans. It was developed by an educationalist within the police. So next slide, please, Carl. Essentially, it is a half-day session. It will cover guides to radicalisation, false news, how to kind of keep yourself safe online. And we are hosting 2 sessions, one in the morning, one in the afternoon on the 29th at Old Warwickshire Hall. And there is a booking link there. If anyone is interested and wants to talk through that more with me, then feel free to contact me outside of the session. Alternatively, you know, just feel free to kind of book yourself on. That would be fantastic. Next slide, please.
I know you're thinking people will bring like a few children from their school, a few young people, or just one, or what's the idea?
It's intended for staff, Carl.
It's for staff. It is for staff.
Yeah,
okay.
Sorry.
So you can get the pack. Yeah.
Yeah.
No, that's
so
great.
You get trained in delivery of the pack. You get access to the resources. A lot of the slides I've made available today really address the issue of risk assessment. I'm commonly asked about that. So what we've put together is a kind of series of points of information that might be able to assist. So next slide, I'll just cover this as we go through the slides. Oh, right, so some of the slides are not in the order I thought. Sorry, Carl,
sorry.
just go back, that's my fault.
So I'll skip forward. No?
Yeah, so, yeah, that's fine. So in terms of the risk assessment, yeah, that's brilliant. So there's a slide that gives you a link to the DFE and the Educate Against Hate template and some guidance notes that have been added to that template just to kind of provide a rounded introduction to it. So clearly it's a statutory requirement. I've been asked in the past, does it have to be written? Well, no, it doesn't specify it has to be written, but clearly there is a strong expectation that it would be. Next slide, thank you.
Okay.
What we've done is put together some resources that I think help. It started with the delivery of a session for early years practitioners, and I've put together this guide which I think has got more generic application than just early years. So you'll see from this slide just some of the introduction to risk assessment and what people should be thinking about. Sorry, next slide, please, Carl. So this is the template. sorry, going back. This is a template that I've populated based on examples that I've seen. Now, I'm not saying this is a absolutely model risk assessment. It's saying I've used or referenced examples that I thought were relevant. I've put those in, I've adapted them based on my experience, and the information covers all of those key topic areas of leadership, curriculum, staff training, preventative, so permissive environment, that type of risk area, and then provided some examples of the risk and the actions that you might want to take. The whole premise of this morning's session is to give you a range of information that you can then test against your existing arrangements. If you feel that you want to kind of discuss any of those with me, then please do feel free to get in touch. Or if you're at the early stages of your journey and you just want to know how to go about this, then please contact me. These are some of the, yes, thank you. These are some of the resources that I've made available to try and assist in addition to the template. So you'll see there's a Warwickshire Prevent Strategic Assessment. So when I come out and I deliver training, yeah, I tend to cover in a nutshell what my understanding of threat and risk in Warwickshire is. But this is a document produced by the Prevent Steering Group. We do it on an annual basis, and it absolutely documents our understanding of risk and our priorities for the county. In my view, you can include this as either directly as an annex to your risk assessment or extract and insert, whichever works best. I've included a document as well, which is an official security rated document produced by West Midlands Counter-Terrorism, and that talks about risk for the wider West Midlands region. Both of those documents can be used to substantiate your kind of judgment of risk for your school. I would just say the Prevent Steering Group document is a public document, public facing, it's made available, that's absolutely fine. The official document from CTU is intended for your purpose only. Thank you,
Jeff,
Carl.
would it be worth just mentioning about the contextual stuff of their locality as well, and saying, obviously this is a Warwickshire context, but even in Warwickshire, you may be on the board with Coventry, you may be on the board with Solihull or Birmingham, and there might be something unique to your area which you might include. And if you're part of those locality groups, you might be attending contextual safeguarding meetings and going, oh, we might have a particular challenge or a risk in this particular cluster of schools which we need to mention, and just showing that level of vigilance that you've got. So I just mentioned that to you. Thank you, Jeff.
Fabulous. I've also included, it's a bit of a resend because I know I've talked about this in the past, but in terms of your risk assessment, the issue of online risks is going to be quite prevalent. So I've included the guide that I put together with my colleague Joe Patterson, because although it's an interactive guide, it will take you to sites that have more information on risk, and again you can cross-reference that into your risk assessment. And the promotion of this, the training of staff in those risks, and how you can secure devices in school and at home are all kind of appropriate mitigating actions. So thank you.
We'll be talking about online safety after Christmas as well. Thank you.
I've put together a slide with some risk assessment tips, and Carl, you've very much kind of headlined what I was going to say here, which is this has to be your risk assessment. So the template that's offered is very much a generic. So you need to think about the particular local setting. So for instance, last night I did some training at the school where pupils were coming from Solihull or other parts of the region. So it absolutely validates what Carl was saying in terms of getting a situational assessment of risk in those localities. And then it just references the information that is available to you on local county risks and in the region. Thank you, Carl.
There's a few more slides of the sort of structure.
The rest is the previous template I've shown was for early years. This is a more generic template, and I've included this in case it kind of supports some colleagues when in the thinking about risk assessment. So the next few slides, Carl, are quite generic to that, and people can look at that.
The prompts of people to think about, Yeah,
so all of those, the offer, if I repeat myself, I apologize, but the offer is there. Please do let me know if you find those resources of assistance. If you think you need additional material, then again, contact me. Or if you want to kind of run through and model how it might mean for your establishment, you can contact me and I'll do my best to support. Just to close, Carl, there was a slide that we kind of passed over, but I wanted to acknowledge that we were hosting or looking to host a DFE ideology workshop. Unfortunately, that wasn't able to be provided outside of our control factors, but we are looking to rearrange these sessions. And I do strongly recommend taking part because
they are really good. Yeah.
Yeah. We don't often, I mean, I cover extreme right wing, but we don't often get a kind of a focus on Islamist extremist ideology structures. So that is something I'm looking forward to as well. I do offer the whole school session, and I just wanted to kind of give an additional kind of comment on that. Free, takes no more than an hour, and that covers the core aspects of the prevent duty, implications for schools, early years, and then running through what is the threat from extremism, recognizing vulnerability, and how to access help and support. That's available to be booked directly with myself. And then there's also the DSL training that's organised through Sophie and that program there. So that looks in more depth at the training. So, Carl, that's
thank you, Jeff.
Those are the key issues.
I know. Thanks for whizzing through that for us. Sorry about the time pressures,
no,
but you know, we really appreciate having you there, Jeff, on the end of the phone. And also, I know how many schools and trusts that you've trained over the past year. You got through, you know, many thousands of people, and also just to say that again, probably on your annual audit, you might have put down risk assessment. So just bear that in mind and grab Jeff, you know, before you do your new audit in March, and you can say, yep, done that, tick that off, and we're much more aware. So thanks very much, Jeff. And Sophie's put the training course date in the chat, so there'll be more information. I'm just going to link on. I'm going to say thank you to Jeff for joining us today. I appreciate that. If you'll stay with us a few more moments, you may wish to comment. I'm just mentioning Martin's Law because I've attended those DFE regional sessions, and although it's not legally binding at the moment, the risk of you will have seen that the risk to Warwickshire is severe, and so we do have to constantly substantial. Sorry, is that the right word? So I saw your face and I thought, oh, I've said the wrong word. Substantial. So we always have to think about not just terrorism threats, but actually intruders on site, and what Martin's Law is trying to link is with your security, your safety, your health and safety, things like fences, things like gates, and it's making links between what you do if you do the Warwickshire health and safety checks. If you subscribe to that, it all fits together. It's about just reducing the risk of strangers, whether they're terrorists or not, walking onto your school site and being a risk. So there's lots of guidance about emergencies, lockdowns. Sometimes we have lockdowns and it's a precaution. We don't know. There's a package. There's a something's been left there. We need to take that action. So just making sure that you've prepared for that. Maybe consider your training day. Have you tested out your alarm or whatever it is that you use to let people know that there is a lockdown situation? Martin's Law is part of, you've got, and you might need to remind me. There's prevent, protect, and there's another word that is. I can't remember what it is now, but there are three parts. One is
being prepared, Carl.
Prepare. That's the one we're doing, preparing and protecting. And so Martin's Law is something that's happened as a result of the Manchester Arena bomb, and there's potentially a bill that will be put into legislation in this Parliament, maybe this year, we don't know, which will say that every organisation, every location, whether it's a town hall, whether it's a school, whether it's anywhere that hosts groups of people, includes schools and settings, will have to have a named person responsible for taking charge of, first of all, preparation and planning and reducing the risk assessment, but also then kind of like fire marshals being responsible for the evacuation and the dealing with that situation. And that's where your prevent risk assessment is setting yourself up ready for that. It's the next stage on, really, which will be what actions you take. So I'm mentioning it now because while we're thinking about one thing, you can be thinking about the next step. And who is your person in school? Have you got somebody lined up? Could you be thinking about that in your next round of appointments or job changes? So you can read a bit more about that. It's not something to panic about because it's not law, but it's on its way. It's on its way, certainly. And so this is some more information here. There's some really good information. You can register. I tried this out myself this week. You can register Act for Counter-Terrorism yourself as an individual, and it does online training. So you can go on, and it's a bit like I don't know if you've ever done, there's a hazard perception test while you're driving. It's a bit like that. So you're walking through the school and you notice somebody walking without a lanyard, for example, and you click on the hazards on these types of things. You click on the hazards and go, oh, what's the hazard? And it tells you what the hazard is, and it's quite good. If you were to register yourself, you could run through that on a projector as a staff training exercise, and that would help you just raise awareness of, tailgating, walking through the door behind somebody else, or gates left open, that kind of thing. So it's useful. It's worth a go. And then there's the videos for young people. It's not really suitable, the videos for infants and juniors. They're a little bit scary. They're animations, but for secondary school, colleges and so on, they're good. But have a look and, just start, maybe give somebody that task to have a look at it and start thinking ahead. All right. So, but it might be worth a look. Okay, so we'll move on to the next subject, which is vapes. Thanks, Jeff. Vapes, just a re-mention that's been in Heads briefing and a heads up. The police have issued some guidance on laced vapes, which are vapes which have materials in there which are hazardous, such as THC and cannabis and other potentially very dangerous materials inside it. And it's just a reminder, this is for young people who've had a vape. So perhaps they've been caught with a vape, or you've been told they've had vapes, but they present ill. So it's particularly that they're looking for the children that are presenting ill after having had a vape, and they're trying to identify where the source is. If you possibly can, this is the instructions for what to do, how to report it. It's contacting the front door and the police. And they really want to capture the actual vapes and try to identify what materials are in there, as well as keep the child safe, obviously, and trace the source so we can stamp that out in Warwickshire and around the area. So there's guidance there. There's a police intel form that you can send in as well if you've got concerns about anything along those lines. If you think there's something going on in your local area, but you don't want to actually call it in specifically as a named person, you can submit a protect intel form and you can tell the police about potential risk that you think there might be going on. There might be vapes being sold at these shops. There might be this going on in this family. So you can submit that protect intel form. And then there's public health guidance as well, which is you can share that with your general public, parents and so on, about what help they can get with vaping, how to, try and wean yourself off vapes, what the laws are and things like that. So that information is out there as well. And there's posters as well. You can go onto this website and there's loads and loads of posters. And there's a safeguarding network training on vaping as well. So it's just a quick mention. I don't want to play the video. Oops, it is. Okay. I've mentioned lifelong links. I must have had a slide in the wrong place. So I'm just going to mention that again. So we're going to invite those guys to our session in January. Apologies, the slides are in the wrong order there. And there's a video you can watch. So I'll skip through that. Right, the bit probably what you've been waiting for now in the last part is on Pathfinder. So I can't answer every question on Pathfinder in this short time, but we'll do our best to give you the next stage. So what we've done already back in September was just give you a taster of what's to come with Pathfinder. It's going on. Hopefully, if you're here, there's different names for it. So Families First for Children, Pathfinder, they're all the same thing. Slightly different names, but the official name now is Families First for Children, and the process is a Pathfinder process, like a pilot, but slightly different, because we are a leading authority who are doing this process in advance of other local authorities. So this is basically where it came from. I'm not going to spend a lot of time, and I just emphasize some of this stuff is to look at later. I'm not going to go through everything in detail. You can also use this with your staff and governors at school. If you want to tell them about where it all comes from, why are we doing it, then this is the kind of information. So, there were stable homes built on love. There's reports from Josh McAllister. It's all based on a lot of pieces of best practice for children's services that have been put together by experts, and how the country is going to move towards this, really. And we are at the forefront of these changes. Some counties are doing little pieces of it, but we're one of the few that are doing it lock, stock and barrel. And every county will have to do it by 2026 anyway. This is just a sort of little thing to say, look, there's going to be loads of stuff in these documents and all of these PowerPoints and slides with new phrases that you'll go, what on earth does that mean? We have this Watch Your Words document here that we've shared with you in the past. And so that will be updated. So there'll be lots of phrases like family help lead practitioner, MACP. I still can't say this, even though I'm going to be in charge of this group, but MACPT, multi-agency child protection team, Warwickshire Safeguarding Children's Partnership is the new name for the Partnership for Children. So lots of words there. Don't worry. We'll all get used to them. We're all learning all the right words. So just take your time. But it's just to give you an idea that there'll be lots of support coming along the way. So going back to why are we doing it, we're just going to cover a little bit. And again, I'm not going to spend lots of time on every slide. But first of all, why are we doing it? How are we doing it? And what are we actually doing? So why are we doing it? We're going to look at that. Why are we changing our practice? How we're changing to restorative practice, trauma aware, and a context of safe uncertainty. You'll hear that phrase a lot, and we'll gradually unpick that over time. And then what are the tools we're going to use to deliver all of this? So this is an overview, which you might want to come back to later. I'm going to break these down in a second. So the why, the how, and the what. Okay, so you can use that one to kind of go back to them. I'm just going to focus on one at a time. So why do we do safeguarding? Why do we protect children? Okay, we believe in the most effective context of relationships, relationship-based practice. So relational stuff, being able to talk from one person to another and have a relationship which is trusting, gets the best results. A commitment of working with people, not doing it for people or doing it to people. Okay, so it's working with the person to get the results, working with the child, working with the family, rather than saying we're going to do this to you. Okay, support and help should help recognise diversity, social inequalities and individual families. We can't do it on our own. We can't just put in a project and bail it in and parachute it in. We have to have shared commitment with families and multi-agencies. Support comes with power, so we need to be mindful that we're supporting people, mindful of privilege, of bias. Sometimes we need to empathise and put ourselves in the position of the family and their experiences. And the legislation says families succeed better, particularly children in care, if we can try and keep them with their family groups, their kinship, even if it's not their immediate mums and dads, but aunts and uncles, grandparents. They have a better chance of success if they remain with members of their family rather than being placed with families in other counties, which sometimes happens with people they don't know, having siblings split up. We're trying our best to keep those families together. Eliminating risk, we can't eliminate all risk, and I know sometimes as DSLs you want to just take all of the risk away. One of the key things is this safe uncertainty, so managing as much of the risk as we can at that time. We know there's always going to be an element of risk, but we do the very best we can on managing that risk. And then awareness of our values and lived experiences and what we bring to the relationship. So being self-aware, not being patronizing, not trying to, just tell people what to do. So that's the first part. Now we go on to the how. How are we going to do it? We're going to develop a relationship-based framework and for these practices, use the strength of the family as much as we can. So who is the family? Who are the wider people around the family that can support them? Restorative practice, you may have done restorative practice training, but solution circles, so sitting with the family and saying, what do you think? How can you, is there anything you can do to suggest ideas that might make it work, rather than us just telling them and doing it to them? So, have they got solutions that they can offer, which makes them feel part of the process? Again, that safe uncertainty phrase is there. We can't manage every single thing, but how can we minimize the risk and mitigate the risk? And thinking about trauma and attachment, trauma-informed practice, putting that at the heart of everything we do. This is a slide that might be useful for staff. It's just giving you some key messages: family-based decision making, communicating with experts, families being experts in their own lives, and communities, and working, multi-agency working. So a big part of this is working with all of our partners, which we'll come on to in a minute. But that's a slide that there'll be things like posters, which that might be useful to try and share with members of staff, share with families about what we're trying to do. So the what tools and technique: identify tools and techniques to help and support families working with children. So direct work tools, like we'll talk about those in a minute. Working with parents and carers, network meetings. So family network meetings is the new phrase that we'll be using, and we want to really boost those. So they've always been useful, but actually putting families around the table and getting them to talk to each other and find their solutions is a big part of this change. Working with other colleagues, so really close multi-agency working, and the best practice principles. And we want to try and share this vision. Warwickshire has the 5 principles for the best practice in safeguarding and childcare. We want to share that with you and encourage you to uphold those ethos and principles. Another one, which is kind of a summary, really. Some of these documents are just trying to reinforce these messages with you and keep them, keep you thinking about different subjects. So they're just other ways of reminding you about the relational framework. It's all about relational, and hopefully you will feel that the relational stuff, when you talk to people in different agencies, will be more effective. We want to work with you and have good relationships with you, and we want to feel that is developing and you're not feeling patronized or locked out or kept out the conversation. Just to break down what Families First Pathfinder is about in Warwickshire, the 4 main pillars. I've shown you this before in the past, but just going to go through this one step at a time, and again you can refer back to it. So the MASA is the new multi-agency safeguarding arrangement, and this is going to be a national thing, not just in Warwickshire. Every authority has to have a MASA, which is effectively what used to be the partnership, and the partnership used to be adults and children, and now it's been split into a children's partnership and an adults partnership. Okay, making sure parents are clear about partners are clear about how we work to safeguard children, working together and joining up the thinking, getting rid of the silos, being oversight of the Warwickshire Safeguarding Children's Partnership, which has been set up. And this will be a multi-agency, and you'll know that we're working closely with the police, health and education now, much more effectively in the meetings I've been in so far. We haven't got there yet, but we are working really, really so much more closely than we used to. And to improve accountability. And then we've appointed lead safeguarding partners from people in education out in schools to oversee and to have those checks and balances. So that's a big thing, where you've got oversight from people like yourselves in schools going, this isn't working, what are we going to do about it, feeding it back into the system. So the second part is multi-agency family help teams. So not early help, family help now. Okay, and that's something, again, that's a national rollout. You have the family help lead practitioner, and they're really developing those relationships, supporting the families, and that could be any practitioner within the family help teams. It could be an external practitioner. It's not saying it's got to be the school before people kind of say, oh, I bet that's going to be the school. It's not necessarily. It could be anybody from health visitors. It can be anybody who can be leading those. They'll remain with the family, and the idea is less change of personnel, so trying to have somebody that remain with the family. Again, that isn't necessarily the teacher that does a lead professional that has to follow the child from nursery to college. That isn't what it means. It means that if there's a worker that follows that child, we try and keep them in that relationship for as long as possible. And then the early help assessment will change, and we'll talk about that shortly, and the family assessment. So they're telling their story less often. The idea is they only tell their story once or as little as possible, so they don't have to be revisiting that. The third pillar is the multi-agency child protection team, or the MAP. And so that is police, health, education, FAST team, and youth justice. And that is where the child protection part happens. It's actually splitting off. So if you imagine the front door, it covers all early help, child in need, and child protection. This is the focused group, which will be on child protection only. And it's where it's necessary. It's carried out by social workers, as parental representation, family network engagement, and a family help lead practitioner. And that team there'll be teams there that will be working with FAST team and professionals working together, taking those calls, getting that information together for strategy meetings. Talk more about it later. And then the last one is something you might not see as much of, which is about financial support to family networks. And when we're talking about trying to keep families together, sometimes a family is quite isolated. Maybe some of the parents or the partners are not easily able to come and care because they work away. Maybe there's an aunt or an uncle that lives maybe not that far away, but we can get them to come and move in and live with the family, or we can find transport, or we can find items to help them in that home, which will facilitate a family to work more effectively together and protect that family. So there's funding available basically to change the circumstances and to help make that family more cohesive and effective together and keep them together. Right, just go on to the next slide. I'll go through as quickly as possible. I'm conscious of time. So a quick thing on what's happened so far: multi-agency safeguarding arrangements. So partnerships have been separated, the adults and children have been separated. They still work together. You may have seen Ramandeep, who's the lead for that. Local safeguarding partners have been appointed, and there'll also be support people that will be on the partnership team from schools and education and colleges, who will also be giving their voice to that. So that's been started. Mentioning now early help and the changes there. So early support, family help are those stages now for that early support, which will then go on to the multi-agency child protection team. You're not going to be able to take all of this in today. Don't worry. You can watch it back later. Just trying to get you to be familiar with some of the terminology. This is from January, okay? But it doesn't mean you've got to do lots and lots of stuff from January. I'll tell you about that, okay? Family help. So key principles. As we move towards, there'll be a period of transition, gradual transition, and getting used to this new style. You don't have to worry. You haven't got to do anything different immediately. Okay, it'll be a smooth process with minimum disruption, with the child's best interest being at the centre of decision making. Quality service, we're really focused on high quality service, and clear and early communication is something we're really mindful of when we talk about this in our meetings. You know, George Shipman, who's our head of this project, says, it comes down to is how quickly people answer the phone front door, and that's what we know is important to you, that communication. So it's very much at the heart of it. Localities wherever possible, and we're all one team working together. So something about the early help transitions, there'll still be support helplines, there'll still be changes, but there'll be monitoring processes as well. Officers will be escalation processes, and all of that will still happen. Just want to mention the aims of family help: removing barriers, increasing direct work, building relationships, and whole system approach to leadership. And these are some of the things as well: consistency, shorter timescales, better support, links with GPs and community partners. And then the MACPT is focused on the Section 47, the child protection only. So it's not all mushed together. It's all separated out a little bit better. The forms, the paperwork will be changed. So, that will happen. But don't worry, that there'll be sessions where we will talk this through with you. You don't have to worry right now. It's not all going to be suddenly different after Christmas where you have to worry, and you won't have to take on these roles immediately. So one plan, there'll be a name change. Okay, the process will be streamlined. There'll be less work, less paperwork. And again, these are the principles of what we need to include in it: pathway to change, children with disabilities, and early support. More information will follow. So what's happened so far? Been set up in the 5 localities. All of this has been happening behind the scenes. So many people in Warwickshire have kind of had to move roles. So please be sympathetic with a lot of our workers that have changed roles. Revising the spectrum of support to have one plan. Teams, there'll be team managers in each locality. There'll be domestic abuse experts, family support workers, wraparound workers, practitioners, substance misuse, mental health workers, PCSOs, and business support. So we're trying to bring more support to your local area. So we are working really hard on things like mental health and to give you better access to some of these services and to join them all up. And this will go live from January, but you won't see immediate change. It will happen. These people will start to move into these roles. They will be there in the localities, but the process will remain fairly similar for you to for the immediate time scale. For the family help, so the children and families front door will go over from being a MAC form. Some of you may be having a little cheer, perhaps, I don't know, that you won't have to fill in a MAC form in the future. And that will be a conversation with conversation about what your referral is about. So you can talk about that. It'll be a restorative conversation. You'll be listened to. People will be patient. There will be a coaching conversation, encouraging you to give all the information you need. Obviously, you need to still have your facts to hand, that you need the information, the evidence to be able to share that on that phone call. But it should be a more seamless journey, and you should be having more multi-agency partners around that, and it should be a faster. The aim is to really improve the speed of the turnaround of the assessments and a more effective assessment. So I think we're talking about, from weeks to days here. So it's going to be a lot more streamlined. And the reason we're having an MACPT is because it's in this document here, keeping children safe, helping families thrive. There's a lot of documents that are the basis of these changes. And so that's the reason we're doing it. We're not just doing it on a whim. It's all structured. There's more stuff there about the MACPT for child protection meetings. It's going to be, very rapid, very effective. And I'll be the manager, the service manager for this group of people within MACPT. So the education is a key part of that, but we'll be linking with the FAST team, youth justice, children in care, children leaving care and going on to employment. The idea is that we're bringing an education perspective into Section 47's child protection, with lots of people that will be available, lots more capacity to contact you and support you through that process. There'll be 2 teams. These are 2 new teams we're working on. One will be in the Justice Centre in Nuneaton, where I was this week, in the centre of Nuneaton, which is a police station, the courts there, and the other one in the Leamington Justice Centre. So there'll be teams of people working there on these conversations about child protection. There'll be a lead child protection practitioner. There'll be a social worker. They'll lead that process with child protection, and then all the other professionals will work alongside them, education people, youth justice, and we'll all link together to gather that information for those child protection meetings. So that's what we hope will be really, really effective, and we'll be working closely with them on that. And then there'll be parent representation by advocates who are being appointed as well, which will take a bit of pressure off, I hope, off you, because it will give the parent somebody impartial to support them through the process. So far, family networks, we've got family group conferencing that have changed to family network meeting, and then family network support packages. As we said, that all this terminology will change. So there will be more changes there. I'm not going to spend too much time on it now. And this is how we're going to measure the quality of what we do. So I just want you to know, there will be feedback opportunities. We will want feedback from you throughout the journey. We know it's going to be tough. We know there'll be things that won't always go perfectly, but there will be opportunities from partners here to give feedback. Just bear with us, be patient, and do tell us what isn't working. That's fine. There'll be a way you can tell us about that. This is the time scale. We're nearly at the end now. So this is the process as it stands. So it's already started. This is the sort of November. We're all doing our training now for what's going to happen. The workforce is being inducted from now until February. So there's still lots of changes going on. Not everybody's in position yet. The MACPT should be launched in December, the 2nd of December, I believe it is. So that bit will be changing, but you probably won't see any difference. You just do what you do normally. You don't need to worry about that, but the calls will be transferred to that team for child protection. And then the full implementation, all of these things should be in place by March. So that is the point, really. We don't want to share too much information too soon because there are still some things we need to tweak and adjust. We're still adapting it. So we've mentioned that there. Partners, this is your timeline, really. So we told you a little bit about it in September, November, October, November. We're starting to finalise. This is starting to finalise the information now. The stuff I'm giving you today is a bit more concrete. It's more tangible. It's all been planned. Okay, November to February, we've shared some more information. In January, February, there'll be some sessions, there'll be some workshops or road shows or a conference in your local area where you can go and find out more about the detail of what you actually do for family help. So all of this stuff is being prepared, being printed, being produced. So you will have opportunities to find out more. And you don't need to worry until you've got all of that stuff. You can start then asking questions of the trainers. This is what we do. What about this? What about that? They can answer the questions for you. So all of that will be happening after Christmas, but it's not something you have to be doing before you've been taught how to do it. So please don't worry. And then in that process, as we go from January to March, initial feedback will be really important. So we can tweak it, we can make adjustments. And then as we carry on, obviously, we still want your feedback as we're going. Just going to try and move on to the next slide. I can see there's a couple of questions in the margin, but I'll have a look in a second. We're nearly at the end now, I promise you. And I know we're coming to 9 o'clock. So sessions in early January and February, look out for those sessions. Please look in Heads Up, look at all those things where we normally share stuff with you. Keep an eye on your emails. You'll notice slight changes, but, just not huge changes immediately. familiesfirst@warwickshire.gov.uk. Please email them if you've got any concerns, if you've got any questions, if you think something didn't go the way that we've told you it should. Please use that email and just say, in a supportive, in a restorative way, I know you're doing really well, thank you for this, but this didn't work very well for me. Can you tell us more about it? So let's have a look. And this is a big plan of what's changing. And I just want to focus here. These are all the things in detail that you can look at later. What do I need to do differently? Okay. Nothing immediately. Listen out for information. Phone Family Connect. Nothing immediately. So do I need to rush in to do stuff immediately? No, is the important message here. Just telling you what's going on so you're aware of it, but you don't need to do anything for a lot of these things for a couple of months or more in some cases. Okay, I'll just look at so materials. So there'll be lots of materials that will come out to you. There's these places you can go to. All of these things like posters, 5-minute guides, little briefings on what to do each section. So it'll help you with that. Little videos, little animations that can help you, that can help train the staff, make the staff more aware, make parents more aware. We're really mindful that parents are going to want to know what's going on, so there'll be stuff for parents as well. Watch your words, the terminology, brochures, all of that stuff will follow. Okay, it's a huge project. I'm just going to check. I've got a couple more slides, but I'm just going to check. I'll just run through the last bit before I go back to that. Just say, I'll come back to the questions at the end. What if things don't work? I'll just go back a step. What if things I don't know what to do? What if I get things wrong? There'll be, you can email the Families First team. How am I going to prepare if I don't know the answers? you can't control everything. So I just encourage you to try and just do your best. Do what you do every day with children, keeping them safe. You can't control everything, and neither can we. We've had to learn to go, I just don't know all the answers at the moment, but we'll find out. So you can attend the updates, read the bulletin, reinforce early intervention, confirm school procedures when you know them. Thanks very much for joining us. I'm nearly finished now. And just reaffirming it, worrying doesn't make anything any better. It only makes, worrying doesn't take away tomorrow's troubles. It takes away today's peace. So please don't spend today worrying about this. Actually go, you know what, this will happen. We'll get the information, get through Christmas, and we'll take that on board after Christmas. Some very quick other reminders. So stuff about add everyone on WhatsApp. I think that one is. Watch out for that one. Home TV, a current concern, and you can look back at the slides. If you've got concerns about these, you can refer them in. Over Christmas, things about refuge, to share support services with your families, signpost fees, follow local procedures, duty teams, update us if you've got any changes of staff. Please let Sophie know through the email. And things to think about, we'll send out in the bulletin or soon. Candles and fire safety, Orbeez, those things you put in water, mindful of those and telling parents. Ice safety and water safety, I'll send some stuff out to you from ROSPA. Christmas holidays, we won't be asking you for contact details over Christmas. We'll use your summer contacts. So if anything's changed, let us know. Hopefully we won't need to contact you, but we may need to over the Christmas holidays. So be aware of phone numbers. And then we'll update you in January. Tell us how we're doing, and please, we're obviously going to change things after Christmas, or there'll be some things we might tweak. What would you like us to do differently? And contact us, let us know. Please, a lot of you still phone my mobile, but if possible, can you phone us on the generic number? Because I could be presenting, I could be in a meeting. So if you can't get me, please use this number and it will divert to one of the other members of the team. And just to say thank you for all your time and your hard work as DSLs and head teachers out there. I am going to take down the screen and we'll finish the recording in a minute, but thank you so much for all you do. Thank you for attending today. I know lots of you have attended. Thank you to our speakers. Thank you to Sophie and Heidi as well. And we'll take the screen down now and we'll stop the recording. Have a really good Christmas if we don't see you before, but we'll send out emails and newsletters and bulletins before Christmas. Take care.